often don't.
Recording in progress.
Oh yeah, you weren't recording yet.
I was before.
Okay, good. So yeah, so just really trying to help both the birthing person and their partner really feel involved, really feel like they know what to expect.
Now, I do
And-
have patients tell me that they were interested, female patients, that they were interested in home birth, but their partner was not. So if that is something that is going on in your relationship, you could have an opportunity to meet with a free
Absolutely.
consultation
Yep.
to talk about what that is. And so everybody can have a conversation about what your personal risk factors are.
Absolutely. And just more about home birth in general. I mean, again, like you said, our reference culturally is from the movies. And if home birth is portrayed, it's usually in a pretty crazy light.
Yes.
Birth in general is always portrayed as an emergency or something that's, really out of control. And so most of the time, I mean, I'll be honest, most of the dads that come in the office are pretty skeptical, and a little bit like, I just don't know about this idea. And, we really just find that providing the information, we're very transparent about our statistics and our experiences, even if they're not optimal. What are the true risks? How can we mitigate those risks? Who is a really good candidate for home birth? And we find that when we can have that conversation, that usually everybody starts to feel a lot more comfortable. And then after the birth, the dads are like, oh my gosh, why would I go to the hospital?
Oh, that's cool. You see
sure.
that. So let's talk a little bit about somebody for whom home birth is a nice option. So I talk to my patients about 85% of births are typical risk. And in my opinion, if you're typical risk, then 85% of pregnant people can qualify to be using a midwife and home birth. It's when you have a high risk issues that you benefit and belong with an OB and in a hospital medical setting. So can you talk about some of the ways that a person could have a lifestyle and a pregnancy that keeps her in the typical risk? Because Jennifer doesn't want her clients who start out low typical risk and then at 5 months they're jumping into higher risk because of modifiable factors. So can we talk about the way, because I know you're educating and supporting people and that's part of what you talk to them about.
So yeah, I mean, again, I think one of the biggest differences between the midwifery model of care and mindset and the medical model of care is the expectation that this is almost always a normal experience, that it is, that our bodies work, and that, yes, there are some risk factors that can arise, but for the most part, it's an experience that our bodies can do without needing a lot of medical intervention. It's a normal human experience.
We were born to birth.
Yeah.
That's how we have our vaginal canal. We were born to do this. So you're perfectly capable of doing it physically. If you are in a typical risk, you're capable of doing it with a midwifery model. And I always tell patients that they need to prepare their mind, body, and spirit. You really have to do your work. And I find that my patients who choose to work with a midwife are already dialed into that.
They're usually coming to us because that's already their mindset and already, how they want to make their choices. And so, and then we really work to support them in the best that we can in that way. So there's very few things right off the bat that disqualify somebody from home birth midwifery care. Those things are generally a history of uncontrolled high blood pressure, type 1 diabetes, an epilepsy disorder that requires that they be on medication. So really, pretty big things that do really affect one's health that would really benefit from medical care. But outside of a few of those major things, most people come to the pregnancies being just fine candidates for home birth. And then from there, my job through prenatal care is really to evaluate that pregnancy, evaluate how the baby's doing, and make sure that we're still healthy and low risk the whole pregnancy. So every once in a while, something does come up in pregnancy that, is a risk factor. Our first step is to see what we can do with lifestyle. Sometimes it's a matter of, finding better resources for controlling stress. Sometimes it's a better, exercise routine. A lot of times it has to do with diet and nutrition. So we end up talking about diet and nutrition through every prenatal visit. with lots and lots of resources and support for that. So we have a big lending library of books and some books on nutrition that we recommend that everybody borrow at some point in their pregnancy.
I love that, because you don't receive that in the medical model. They really, they gloss over your food and nutrition needs and how that might impact hypertension, gestational diabetes, mood, anxiety, depression. I'm assuming you're providing this holistic viewpoint for how to nourish your baby and nourish your own body, because you're growing another human being. There's a lot to that. So you want to be eating very nourishing foods.
Yep. Yeah. And ultimately my goal, my highest goal for everybody that we work with is a healthy mom and a healthy baby. Most of the time through those factors, through really working with optimal nutrition and lifestyle, we can have a healthy, safe birth at home. But ultimately my job is to decide when we need more medical care and when the safest thing is actually to be in medical care. And that's where our statistics can really highlight, and that's all on our website. Again, just trying to really offer up that information and be transparent about it. You know, the amount of time that we do have to transfer to medical care, because our goal isn't a home birth. Our goal is, you know, very healthy families.
Yeah. So you can hear how calm Jennifer is. She's got this dialed in. So if you are in her care over the 9 months of your pregnancy, you're going to have these 1 hour prenatal appointments, and she is assessing you for any of these risk factors. And you're going to be very clear about what's best for the baby and the mom when unfortunately somebody does during that pregnancy end up risking out. But before that point, you're talking to them about modifiable lifestyle factors. You mentioned the nutrition, and then you mentioned exercise and stress. So you're talking to them about movement and things that might be able to be done to help with hypertension and pain and things like that. I'm assuming preparing your pelvic floor.
Drinking enough water, getting enough sleep, asking for help, you know, finding your community so that you have the emotional support that you need and the time that you need to rest, especially if you have older kids. You know, pregnancy is really taxing. So I'm just really, really trying to help brainstorm all of your resources.
Yeah. Well, let's talk a little bit about the actual day of birth.
Sure.
So when does the person contact you? I imagine they're probably in communication with you quite a bit, because they're for a whole week, they're probably wondering if they're in labor.
Sometimes.
Yeah. Yeah. So what does that look like? When would you arrive at their home? The doula might arrive before you. Or
it depends. So a lot of people don't have doulas, but if they do have a doula, usually they're there more in, you know, during that early labor time. These are all things that we talk about in detail in the home birth preparation classes and at prenatal visits, so that hopefully by the time, you know, labor is starting, everybody knows which number to call, how to be timing contractions, what are those signs of labor, and when they should be calling us. It's pretty common that throughout early labor, we're in touch a lot, sometimes texting, sometimes phone calls, but just kind of keeping tabs on it.
Yeah.
We also know that labor, and this is the real beauty of home birth, is that labor progresses best when you feel private, you have your privacy and you feel safe. And so where else do you feel more safe than in your own home? So it's not always helpful if we show up right away and we're just kind of,
it feels like game time,
you know, in your space. And so there is
that.
a lot of, you know, kind of back and forth, like, when have we moved from early labor into active labor? And it's our goal to be there in active labor to monitor the mom and the baby and help, you know, provide some direction and you know, help with labor support. Doulas can be a great part of that. And I would love to see more people have doulas at home births, because they can help kind of navigate that early time and help the mom decide, the birthing person decide when it's most appropriate for us to come.
So let's also talk about the whole experience, because Jennifer offers a water birth or aquatic birth also. And she comes with a team of people. So she is not just coming by herself. She has another person always with her, and they provide everything you need for this experience, including the cleanup. So can we talk a little bit about the water birth options? How does that happen? And because you're providing that equipment.
Yep. So we will come visit you at home around 36, 37 weeks. So that time when you're when you're due, we'll come and visit you at your house so we know how to get there, because I don't like trying to drive fast blind at 3 a.m. and figure out where you live. And we'll bring you the birth tub so you have that in your home ready to set up for when labor starts, because that can be a helpful tool before we get there even. So usually it's the partner's job to have a plan for getting the pool set up and filled with water, but that's something we provide and information directions about. And then about half of people end up having their baby in the water. But almost everybody finds it a really helpful tool. And if they don't use the pool, they often will still spend time in their own shower or their own bathtub, because water is just such a helpful tool for labor. Yeah, but it really depends. And that's the other beauty of home birth, is you just get to move around. You get to move around as much as you want. I have no expectations about where you have your baby. I love to share the funny stories of where people, they may have a whole beautiful area set up with the pool and Christmas lights and their affirmations, and then they end up in their tiniest bathroom or even the closet, and because sometimes those spaces just feel safer.
Yeah, you like your den.
And so we're ready for that. We're really portable. We'll just bring all the things we need to you wherever you decide to be.
That.
So sometimes people labor, in and out of the pool the whole time. Sometimes they decide they want to be in it at the very last minute, and maybe they're literally in the pool for 5 minutes before their baby's born, but they find that really helpful. So
So let's talk about positioning when the baby is arriving. Do you have, I know a midwifery model is very team-based, and it's supporting the person who's going through it. And so you're going to kind of follow the lead of the person. But do you have positions that work better or not as good? Or how does this all work for you?
So again, like ahead of time, just really giving people a lot of options and ideas and visuals. We think reading birth stories is super helpful, because I can't tell you what your experience is going to be like, but the more positive stories you get to hear, you can override all those things you've seen in the movies and the weird things people tell you in the grocery store, and have a positive vision for what your birth can be like.
That's crucial.
So we have a lot of birth stories on the website, and then in prenatal care, we often tell a lot of birth stories, and in the home birth class, we show a lot of images, so people have kind of that background database of like, oh, that's something to try, or maybe that will work. But more than anything, we find that just being in your own space, where you are used to doing whatever you do, that you can just work really intuitively in labor. You can follow your body. Your body knows what to do. You're not really operating in your thinking brain. You're just operating out of instinct and just kind of doing what works for you. So women end up in all kinds of positions, and we're game for that. So
any position, right?
Pretty much any position.
You are also monitoring kind of the position of the head or the elbow, and you will, as needed, guide a person to a position.
Yeah.
Right.
Yeah. So sometimes, especially if it's a first baby, or if the labor's just not what we expect, or something feels off, then we will definitely try to assess the baby's position and help provide some specific direction for what positions would be helpful with that. And that's information we talk a lot about at the end of pregnancy. We really love the Spinning Babies website, which really talks about optimal fetal positioning. So we encourage everybody to do a lot of exercises, simple stretches, everyday things ahead of time, to just have their body ready, have their ligaments. It's usually more about the ligaments and those structures than it is the shape or size of the pelvis that allows the baby to fit well. And so that's why we recommend chiropractic care, and we find you to be a wealth of knowledge, and the Spinning Babies website, to just really make sure that the baby can get into the best position. And then if they're not in labor, then we'll use sometimes the reboso, sometimes some specific positions supported with pillows. More than anything, it's just movement. So sometimes it's not, there's a magic special position to do, but just keep moving. And
the movement is
upright.
Crucial. Not being in the bed is very important. And I find with the pregnant people that I'm working with, like recently I just had somebody who had a baby recently, and she called me afterwards, and we were talking about it, like, congratulations for your baby. And she was amazed at how well this birth went. Now, every birth is different, but she felt, because she had come to physical therapy and she had she did do some of the Spinning Baby stuff, and she was able to move a lot. She felt the combination of those things kind of freed up the passageway for the baby so that it ended up being a lot easier than her prior one. And she was crediting it to all of that stuff, the physical therapy and the mind work and the positioning.
Yeah,
it makes a huge
absolutely.
difference.
And the relief from some of that extra anxiety that you talked about being in the medical model, and kind of that assumption that things, so much talk about the emergencies and the risks, really sharing more stories about what goes
That's
right,
true.
and, being more positive about the experience, and then being in your own space, feeling really safe, overrides a lot of that adrenaline that can get in the way of really
That's
good
true.
labor progress. The adrenaline really inhibits the hormones of labor.
So you're talking about being in your own space, and we have a nice question. Somebody's asking if their space could be a condo or a townhome or an apartment. So
it's a super common question
Yeah.
we get. Like, I live in an apartment.
Yeah, I have heard, like I've had somebody say, I think I'll be too loud. So she didn't want to do a home birth in her apartment because she has adjacent neighbors. So what's your answer to those?
Yeah, so there's very few situations where people's living space, it can't be worked with, and that's part of the reason we do a home visit, part of the reason we offer a free consult, so we can talk about those things. First of all, women are almost never as loud in labor as they think they are. Very rarely are they really that loud.
I've heard that.
So
yeah, where it's more the grunting and the groaning is what I've heard. You've been to more. So you're saying we aren't really as loud as we think or anticipate.
No, and the noise is good. It's a part of the process. But yeah, I mean, we'll kind of work it out. We have a lot of births in apartments, a lot of births in very small spaces, which can be challenging. Because it is nice to have, for us not to be right in your space. So it's really nice if, usually we're hanging out at the kitchen table or something and you're in your bedroom. It doesn't take a lot of space, but just a little bit of separation so that you don't feel like we're just staring at you the whole time. We'll come in and listen to the baby every, 15, 20 minutes, sometimes half hour earlier in labor, and give you your privacy as much as possible.
I love that about you. With a midwife, they're not going to be like, you need to do this, get going. Okay, how you turn over. They're not going to be ordering you to do things and making you feel like a deer in headlights. And they don't ever make you feel like you're failing. It's always like, how can we work through this? All right, something has slowed down. Can we try this? Can we try this? You have all the tricks. And when you're in somebody's home, I love how we've talked before about how she really gives you your space, you and your support system, your spouse or whoever is there with you. Jennifer will give you the space to have your space. And then if you want her, she'll be right there with you. But if not, she'll go to the kitchen and hang out, and she listens attentively and checks in on you every 15 minutes or so.
Yeah. And we keep saying we, and I should say, explain a little more about my team. So I have never worked alone. I have always really believed in, I don't want to be your only support, because I'm human, and I get tired. And so I've always worked with a team of people that support me, that support you. And so I always attend births with at least one other assistant. Usually it's a midwifery student. And right now I have 2 students who are almost finished with their training, which is super exciting.
That's awesome.
And then, sometimes someone who's just there to assist and chart, and sometimes 2 students. But, typically a team of 3 can be really ideal. Because one of us is, once the baby's born, we have 2 now people to keep an eye on. So somebody's really watching over mom, somebody's watching over baby, somebody's still charting. And then we do a lot of that cleanup. So the pool, we will usually take out 1 bag of trash, start 1 load of laundry, pump out the pool, pack that up and take it home, so that you're just in bed ready for a good long nap and recovering with your baby and nursing.
I've had patients tell me that there was no mess. They were like amazed, like, you guys are magicians. You just get it all done. And it's,
yeah, that's another common question. Like, what about the mess? But it's really not.
Yeah, it isn't really. That's what I've heard you say the same.
Yeah. And then the other part of her question was, what are they required to provide that we don't bring with? So we do have everybody purchase a birth supply box. from an online company, and that sends them like the sterile gloves and the pads and, you know, all those extra things to kind of protect your space, keep your bed clean, all of that. But, and the pool liner, everybody has their own pool liner.
Yeah, that's how it's safe.
To keep it really, yep, everybody's individual pool liner makes cleanup quicker. So the whole cost for that birth kit is about $75 with the pool liner.
Nothing.
Yeah, not a whole lot.
Wow.
And then there's some things you gather up from around the house, lots of towels and baby blankets and those kinds of things.
Oh, okay. Now, another special thing about when you give birth with a midwife is that you are really going to support the baby coming through the birth canal or coming out of you in a slow, appropriate amount of time. Too fast is too fast. And my post yesterday was that when you're with a midwife, you have lower risk for perineal laceration, for the area down below getting torn. So can you talk about that? And I know you do provide perineal like compression and counter pressure. I suggest to my patients that they have that is in the clinical guidelines for Australia, the UK and America, that be provided. And a lot of my patients are not consistently receiving that in a hospital, but they'll always get it with you and I think other midwives. Can you explain about that moment when the baby's coming through, all of those things?
Yeah. So there was just a really good review of all of the information about perineal support and kind of hands-on or hands-off at that point.
Yeah. Oh, I read that.
From Evidence-Based Birth. So
I
that's
read
a
that,
website that's full of lots of really, really good information and overview of all the research on tons of different subjects to do with pregnancy and
She
birth.
did a deep dive. She did a podcast on it. It's a deep dive into into the problems with the research and that you can't trust what they tell you.
Yeah, but really, I mean, our goal is evidence-based practice, and we're trying to gather all of that information and see what the research says and all of that. But then ultimately, we use that information to provide individualized, unique care to that birthing person and what works for them. Some of that we plan out ahead of time, and some of that we find out in the moment. So we are always prepared to offer that perineal support at the time of pushing, especially during the time of crowning. Usually what it looks like is, it looks like you're making big progress with the next contraction. I'm going to offer you the support. If you don't like it, just shake your head, say no. Sometimes it really doesn't feel right to the birthing person, and that's fine. We totally respect that. She may know something about her body, or whatever is going on, where it's actually more helpful not to be hands-on, or we'll remind women that they can provide their own support. Sometimes it's, they can really feel where the pressure is and where they need the support much better than us. So we'll remind women that they can do that for themselves too. So it's pretty unique. It depends. I mean, it's something that's always on our radar to offer. My personal view is that sometimes we're really helpful hands-on to reduce the rate of tearing. But I think the most important thing that we do that reduces tearing is, one, again, being at home where there's not the extra adrenaline and stress of being in a really foreign environment and the pressure of, we can see your baby's head, let's just get your baby out. We're not in a hurry at that point. We know it's okay to take time there and to let your tissues stretch. And we will remind you that you can still be in control in that moment and you can gently ease your baby out. So I think a lot of the support and the way we reduce tearing is with that calm verbal support and reminder to take it slow in those. It really is just the last few minutes. It's the most intense.
That's a huge piece of advice. Take it slow.
But usually women need a lot of support for that. So it's pretty common that we're right there reminding them, like, blow. If you're blowing, then you're not putting extra force behind those pushes. So.
And so then once the baby does come out, how do you work with the birth of the placenta?
So usually baby comes out. Sometimes moms catch their own babies. Sometimes dad helps, bring the baby up, but get the baby close to mom. Like I said, one of us is watching over the baby. Usually it's just visual from a distance, kind of keeping an eye on the baby, making sure that they're breathing well, transitioning to this world normally. And then every once in a while, sneaking in there right away to just hear with the stethoscope. And then one person is watching over second stage or third stage, the placenta, and just watching for extra bleeding. But usually there's kind of a lull. Baby's out, everybody's so excited to hold and look at the baby, and we're just watchful, quiet, waiting. And once women have had a chance to kind of take some deep breaths and come back into their body after that huge work, then they'll start feeling a little crampy again, and we'll talk them through what to expect with the placenta.
Okay.
So pretty hands off there. We have emergency medications that are in our formulary with our license that we can carry. We always have on hand. They're always ready for an emergency and extra bleeding, but we don't use them too commonly because just having your baby skin to skin is triggering all of your
Yeah.
body's natural hormone response that reduces the
That
amount
from
of bleeding.
happening.
Mhm.
Yeah.
Yeah.
Yeah, I wish somebody had told me that years ago.
Mhm.
So in your first hour, they call that the golden hour.
Mhm.
Jennifer and midwives really, really value and respect that first hour where the baby is outside of the womb. And maybe it goes past the first hour into the second hour. So
Mhm.
talk to us about why that's an important skin to skin time, why we're working on letting the baby crawl, to latch,
Mhm.
all of that. It's
Yeah.
really a precious
So
moment.
many reasons, really. You know, like I said, moms have just done the most intense work of their lives, so they need, some peace and some quiet to kind of take some deep breaths. It can be really overwhelming if there's a lot going on, and usually the lights are low, and we're whispering or keeping our talking to a minimum, just so that it's all about you, your baby. They know your
Oh,
voice, they've
so
heard your
sweet.
voice the whole pregnancy, and now they want to see your face. And we don't want to get in the way of that. We want them to see you and get to know you, and match, your voice with their face, and start breastfeeding. The skin to skin time will help them really quickly regulate their temperature, regulate their respiratory system, which is all working for the first time. So we really try not to interrupt anything for the first while. And I would say sometimes it's more than an hour. We will try to delay any moving, any, checking over of the baby, mom up to the bathroom, like any of that until the baby is nursed well. So we'll delay like the newborn exam. So sometimes that means we're doing the newborn exam an hour and a half or 2 hours later. We're delayed cord clamping is our standard. And for us, delayed cord clamping usually means that the placenta is out, because that's when we know it's really done with its work. So every once in a while, if a mom really is uncomfortable or the cord's really short, then we'll cut it first. But then our priority is that it has stopped pulsing, that cord blood has all moved back to the baby from the placenta before we clamp and cut the cord.
Wow. So that's a different model than what you would receive in the hospital, where they take the baby over there, they do APGAR scores, they're rubbing the baby.
And we're doing an APGAR score, and
I
nobody
know
ever
you
knows
are.
it. Like,
Yeah.
we just do it while we're watching all of those things I just described.
Yeah.
It doesn't require us to pick up the baby and inspect them at all.
Isn't that amazing? So you get your APGAR scores without anybody even interrupting you. You're having your baby skin on skin, and we're trying to promote that first latch. So talk a little bit about your support for lactation and breastfeeding, because that is a big thing that you do get from Jennifer and her team. They provide a ton of support and education when you're pregnant, at this moment we're speaking of, and even afterwards. So what does that look like?
We find that the families who have a normal intervention-free birth with that, protected time right after delivery, just naturally have a much, much easier time at breastfeeding. So when that baby has that chance to really learn it for themselves, do it themselves, instead of having somebody kind of, after so much interruption and distraction, then, kind of put there and lined up, the baby being there and doing that exploring themselves and really learning it for themselves. That first time just sets everybody up for success, and it becomes so much easier for the next, for the whole breastfeeding journey, really.
Now you might Google and see if it's out there. I'm not positive it is, but there might be videos where you can watch the baby crawling. It's amazing. This brand new baby that's minutes old, and the baby's tired too. The baby just takes its time to try to find that area. And like Jennifer said, that's producing all of your hormones, and everything is getting going in your body and your baby's body, trying to help your uterus so that you can get rid of the placenta. It's amazing that that baby is able to latch. It's like so beautiful.
Yeah, all of their newborn reflexes are geared around learning how to nurse and suck, swallow, breathe, all of those things. So they'll get themselves there. We do like to help a little bit. We don't want to make them do all the work, but
Okay, so with a baby that's now an hour or two old,
Mhm.
at that point, and the first latch and nurse has happened, at that point, that would be the first time that you are now potentially weighing the baby, right?
Yep.
Yeah.
So once they've nursed well, then we'll weigh the baby. So we let them get a few more ounces in, and then sometimes they pass some meconium, so maybe it evens out. But when we do the newborn exam, we'll start by weighing the baby, checking them over from head to toe. We do that right there, usually on the bed with the parents, so they can both see, and we'll talk you through everything that we're assessing. And I see someone's question, do we revise tongue ties? Which that's something that we are looking for on the newborn exam. We do kind of check for that. However, I don't want to say, oh, there's a tongue tie, you're going to have a really hard time nursing, because sometimes it doesn't interfere with nursing. So we kind of make note of it, and then we keep a close eye on breastfeeding and make sure we're providing as much resources and support as we can for breastfeeding. That's, almost always normal. But when it isn't, if a tongue tie is getting in the way, I'm not the expert on lip and tongue ties. They can be really difficult to assess well. And so I want to hook people up with the people who know that best, the people who are experts on lip and tongue ties. So usually the first step is I will suggest an IBCLC, and we have lots of great lactation consultants in the area who do some really amazing work. They do home visits. A lot of times they'll come right away, because we know the sooner we address it, the better the outcome for breastfeeding. And then there are a lot of pediatric dentists in the area. So we will refer, and the IBCLC will really help refer straight to a pediatric dentist, so we can get those things addressed as soon as possible.
We who work in this space of pregnancy and postpartum, so I'm a physical therapist, you're a midwife, we are very connected with the birthing community. We know all the doulas, we know the pediatric dentists and who you might want to go see. We know who the cranial sacral therapists are who can help you. We know where your support exists. And Jennifer is amazing with being able to support breastfeeding and working through that. But if you are running into some difficulty with it, she knows where to send you. And one place to send you would be her husband, Rich Holshoe, is a cranial sacral therapist, and he works with babies who do have tongue tie. He also works with people that have migraines or any sort of pain. He's been doing it a long time, and his office is out of her office in Caledonia. And he has a website, which is West Michigan Cranial Sacral Therapy, cranialsacraltherapy.com. So there are so many resources for you if you are struggling with breastfeeding. And after you've had your baby, you still have Jennifer coming to your home in that first week to be supporting you, and then you're having postpartum care for you and your baby. That's one of the differences. You don't have to go find a pediatrician day 2, because you are serving that role, right, for the baby.
Yeah, we encourage that everybody has their pediatrician picked out, that they know where they would go
Sure.
if something comes up. And when we do that newborn exam, again, almost all the babies we see are healthy and everything's normal, and we'll point that all out. But if there is something that requires a trip to the pediatrician, we'll point that out too. But for the most part, our goal is that people are just home, resting in bed, nursing, letting their community come and take care of them and feed them for that first week or 2. So we think it's great for partners to take as much time off of work as possible in those first couple of weeks, so that the whole family can just transition
and hunker down a little bit. Yeah, it's nice that now there's some paternity leave. I've had over the last maybe 5 years, I'm having more couples where I'm hearing about that. Like, oh, wow, I love that. And some adoption related leave too. Some individuals
and if you
get
don't
that.
have it, sadly, it is a great use of your vacation time. Thank your
Yes,
vacation
it's a
time
special
for it.
moment,
It's worth
and it helps everybody bond to the baby, and your family get into a rhythm. And we who just birthed, we need support. So we do need people to wrap around support for us. What other things do you have to touch on with regard to midwifery? And if anybody has any other questions, type them in there.
Yeah, I mean, I'm excited because I think things have come a long way in Grand Rapids since I started practicing. there's great options for midwifery care within the hospital system too. So if
Yeah.
home birth in and of itself feels overwhelming or doesn't feel appropriate, or maybe you really do live in a, maybe you just rent a room, whatever your situation is, there's a lot of reasons why medical care does make sense, or being in the hospital does make sense for people. And I'm so happy to say that we have a lot of more and more midwives within the hospital systems here. So
They just
hospital
added
birth
this
is
week,
an option with a midwife.
Spectrum Health just announced
Mhm.
midwife services at Zealand Hospital.
Yeah, so they just keep increasing that, and I'm really happy to see that. And then we have more access and more community and networks within the medical model too. So it just makes everything more fluid. And if we need medical care, we can get that a lot easier than we used to be able to, which is really nice. And I think it makes midwifery care and home birth safer for everybody.
Mhm. Well, this was so educational. I really appreciate you talking through the prenatal, the moment of birth, the postpartum, the lactation, and all of the support. Now, a few things that we can talk about if somebody is interested in learning more is you do offer a free consultation with somebody, whether they're pregnant or even thinking about trying to conceive, to talk through what their options are. You also, once somebody is your client, then you offer the birth preparation class at your office or over video. You also have some lactation support things that you offer.
Definitely a lot of resources and connections. Where can you go for that support as well? We have a free breastfeeding class that we offer link to, so that people can do that online during their pregnancy as well.
And you mentioned that in May, you are planning to host like a community event because you want more people meeting doulas and other support. So talk about that. You don't have your date, but what is that?
So watch our social media. We are pretty good at keeping, new events and new happenings and even new research updated on our social media. So both Instagram and Facebook. Follow us there. And then sometime in May, we plan to have a Meet the Doulas event. So we would like to just support the doula community, for them to come and meet each other, because they provide such great support to each other, and then connecting families who are possibly looking for a doula to meet doulas and kind of find that person that they connect with.
Yes.
And I would say the same thing about midwifery care. That's why we offer a free consult, because it is about who is a safe provider, who has a good reputation, who has good training, but it's also about who do I connect with, who do I feel safe with, who do I feel like I can build a good relationship with. And thankfully there's more and more options in our community for home birth, and hopefully we'll keep building on that, because we need a lot more midwives than we have right now to support this growing interest.
Yeah, I'm so pleased that there is the growing interest. I perceive, having done this work for so long, I perceive that over the last 5 years-ish, there is greater awareness on the pregnant person's mind with regard to what their options are, and spinning babies, evidence-based birth, doula support, midwife care, those things. I'm hearing and seeing more of that than I was before. And in my opinion, you end up having a person who's maybe a little better prepared and more supported during it, when they know all of those options and they've listened to positive birth stories and prepared themselves and found a good team to support them.
Yeah.
So you mentioned following you on social media. I follow Jennifer, and she always has wonderful things. She just had an excellent article that was done. Tell them about the article that came out. Surprise, she was like the headline photo, but it was about midwives. So that came out this week.
So there's a photographer from LA, and she was doing a story on, or doing, a body of work of photography on midwives. She had followed a lot of midwives in the California area, to home births specifically during the pandemic, and how we kind of responded to this increased desire and interest in home birth with the onset of the pandemic. And then she came to Michigan and spent a couple of weeks here following the midwife who trained me, who's in northern Michigan, Patrice, and myself. And Anna and Kelsey are students who work with me, and they're also working with Patrice. So they ended up in a lot of the images, and it was really fun. So she just published article, well, BuzzFeed News. So that's on our social media too. So that was kind of fun.
Yeah, that was good. I thought if I'm honest, I thought that was a wonderful article and I loved the highlight. And I thought there was a lot more that could have been said about
Sure.
midwifery,
Yeah.
but maybe we have limited
Yeah, I mean, I
space.
could talk all day, but we don't have time for that either.
We do have a question
Mhm.
here about your maximum distance
Mhm.
that you are willing or able to travel. Like, could you or your team go to Allegan, or what are the options in Allegan for home birth?
Yeah, so it used to be that our radius wasn't, I used to tell everybody our radius is an hour, but now we've been so busy that we've tried to tighten that up a little bit. We really try to keep it like 45 minutes, especially because winter in Michigan and, you know, and if we're going both directions. But we do sometimes go to Allegan. It kind of depends on our schedule for that time. So, you know, definitely get in touch about your area, send an email. I've got a great admin person. Her name is Amy, and she does such helpful work to, like, if we're full, then she's going to email you back with lots of options for where else you can look for a midwife and who we know of who works in your area, what doulas we know of, and what resources might be in your area. And then also Michigan Midwives Association has a directory of out of hospital midwives in Michigan. So CPMs like myself, all of the membership is in this directory. So Michigan Midwives Association, just Google that. I think it's michiganmidwives.org. And then they have a directory link that will kind of show you who might be in your area. And I always recommend consulting with more than one midwife anyway. So meet with a few people and find out who's around you.
Well, this was awesome. So follow Jennifer Holshoe of West Michigan Midwifery. You can follow her on Instagram at West Michigan Midwifery, and you'll be able to find out when her date in May is, which is going to be that community event meeting doulas. You could also reach out to her through her website. She's mentioned a couple times that she puts all of her data and statistics on her website and is very open with following everything that has happened with her, all the people that she's helped birth. So it's kind of nice to see somebody be so open with their numbers. And then the last thing I'll point out is, again, if you need cranial sacral therapy, you can reach out to her husband, Rich Holshoe, who is with West Michigan craniosacral.com. And then we are Purple Mountain Physical Therapy here in Cascade region of Grand Rapids, and we specialize in pelvic health. And we want to provide any sort of educational material that is helpful for you. This year, we are providing speakers each month, trying to bring people in. Our next speaker is going to be a nurse practitioner who specializes in the female hormones and menstrual cycle. And we're going to be talking about your signs of fertility, a normal menstrual cycle. And I'm going to be advertising it. I would love it if any of you could come and learn about your cycle and your own fertility. And also if a person who already has a daughter who might be a tween or teen could come, so that we can start educating the youth about what the normal piece
with
of their
teenagers.
Yeah, that would be great. Yeah, because normal is not understood in your cycle. And if you can identify when something might be off, then you have ways of being able to tip the scale back in your favor with lifestyle and stress and sleep and other things. It doesn't always have to be medication. So thank you all so much for joining us. I love that Jennifer was so generous with her time and sharing her knowledge. I hope this answered your questions. And if you have any other questions for either of us, you can reach out through our websites, purplemountainphysicaltherapy.com and West Michigan Midwifery.com. Good night.
Thanks for having me.
Oh, thank you, Bethany.